This is an article that came out today, March 29th, 2018, in the Chicago Tribune. I'll leave the link to this article in the description box. I think by now we all know this drug plague is far worse than anything they're ever going to tell us. We know that. Periodically, you'll come across an article where a doctor will just come out and tell exactly how bad it is. They're saying it's getting exponentially worse. Fentanyl behind the latest spike in opioid overdose deaths. Now, it seems to be a spike sweeping across the country in all of these drug overdose deaths. And as you know from many of the articles that I spoke about in the past, there is no state that's not impacted by opioid, heroin, and fentanyl, carfentanil deaths in the US. And it just keeps exploding across the country. This is why Trump had to come out about 2 weeks ago and say something. Because, ladies and gentlemen, they literally don't know what to do. You got to think about this whole thing. They got top doctors and scientists and the Center for Disease Control, the all types of national centers for drug addiction and substance abuse. They got everybody involved in this thing. The politicians are involved, the police are involved. They got drug courts set up, and nothing seems to work. Nothing is working on slowing this thing down. And if Trump think he's going to execute a few drug dealers, that's going to do something, it's not. It's not going to do a damn thing. If a person have an addiction and that urge is strong, nothing, including executing dealers, is going to supersede that urge for the drug. These folks are literally being defeated by this drug habit. They can't do anything to change it. It is not like this started a year ago. This is 20 years in the making. And they still do not have a solution. And over $1 trillion have already been spent on this addiction, and they are still at a loss on how to get it under control. Every measure they have tried up until now has failed. Every single one. They've tried everything. So this article came out today, and it is talking about the overdose deaths are continuing to pile up in the U.S., driven largely by the opioid plague and the emergence of dangerously potent synthetic opioids like fentanyl, a new government report shows. Overdose deaths increased by 21.5% in 2016, a much sharper spike than the 11.4% increase seen the previous year. Researchers from the Center for Disease Control and Prevention reported. The problem isn't just getting worse, it's getting exponentially worse, said Emily Feinstein, Executive Vice President of the National Center on Addiction and Substance Abuse. And she's saying that this is shameful. It really is. It is, ladies and gentlemen. Do not be surprised if some of you, if you haven't seen these addicts out, don't be surprised if you start seeing them for the first time this year. Don't be surprised. That's how many people are abusing drugs. You're talking about people in the millions. It's not like it's a small group and it's something that's controllable. This is why they can't get a hold of this addiction. When you have such a massive amount of people on this thing, there is no way you are going to get this massive crowd on drugs under control now. It done spiraled too far out of control at this point. Okay, so what's happening in our country is shameful. Addiction is a preventable and treatable disease. We know what to do, but we are not doing it. We are taking half measures and expecting better results, added Feinstein, who was not involved with the new study. So, they just talk about that 64,000 Americans died in 2016, but just understand, ladies and gentlemen, that's only from 22 states. They have never, to this point, to my knowledge, they have never done a study on all 50 states. I'm telling you, that number would probably triple or quadruple if you got the real number. But the Center for Disease Control only get numbers from 22 states. The other states don't report their numbers. So you're never going to get the full picture. So the 64,000, just know that's a low ball number. Recent increase in overdose deaths have been fueled by a continued surge in deaths involving synthetic opioids like fentanyl, which we all know coming in from China. And what was one of the first high profile overdose, we know stars have died from this stuff. That's nothing new. They always get caught up in drug addiction. Drug dealers often cut heroin with the less expensive fentanyl, and unaware users risk overdose due to the potentially lethal potency of the synthetic opioids. Dr. Robert Glatter, an emergency physician at Lenox Hill Hospital in New York City. What's clear is that many people are unaware that they may be risking their life when they think they're simply buying heroin to support their ongoing prescription drug habit, Glatter said. People who use heroin should realize that fentanyl could be a potential contaminant, which significantly raises the possibility for overdose and death. The increase in overdose deaths stretch across all groups of American men, women, all age categories, race, ethnicity, and everywhere from rural communities to metropolitan centers. No area in the United States is exempt from this plague. CDC Principal Deputy Director Ann Shuchat. Okay. However, overdose deaths differ between states, with Northeast states bearing the brunt of fentanyl related deaths. The study findings showed New Hampshire 30.3 deaths per 100,000, West Virginia 26.3 per 100,000, Massachusetts 23.5 per 100,000. Had the highest synthetic opioid death rates. So the highest in the country is New Hampshire, West Virginia, and Massachusetts. Overall, death rates from synthetic opioids increased in 20 states and Washington, D.C., with 10 doubling their rates from 2015 to 2016, according to the report. Death rates from other opioids also continue to increase nationwide, including prescription opioids 10.6% and heroin 19.5%, the researchers reported. Increases in overdose death rates for cocaine and stimulants, like methamphetamines, also increased by over 52% and 33% respectively. The findings were also published March 30th in the CDC's, I'm just going to skip down a little bit. Gray Death, which is a drug I haven't heard in a while, often contains a varying mix of heroin, fentanyl, carfentanil, An elephant tranquilizer, 100 times more potent than fentanyl, another powerful synthetic opioid called U47700, which is pink, Glatter said. Gray death actually looks like concrete, varying in consistency from a fine powder to a rocky or chunky appearance, Glatter said. The reason that this concoction is so attractive is its price, $10 to $20, compared with the cost of oxycodone or hydrocodone tablets, which run $25 to $40 on the street. To prevent these deaths, there needs to be improved access to naloxone, the life-saving overdose reversing medication. Um, we are encouraging that each patient to receive opioids with a co-prescribe of naloxone. So they want to automatically give everybody naloxone that gets an opioid prescription. Okay. In addition, Feinstein said emphasis needs to be placed on treating addiction as a disease, including better education on addiction and overdose for doctors and hospitals, improve reimbursement for addiction treatment from insurers, and better guidance from government. Hospitals don't even have protocols in place to know what to do if someone is in opioid withdrawal or someone survives an overdose, Feinstein said. That's shameful. That is shameful. You would think, with all of the overdose deaths that are going on in the country, that they would be a lot more prepared for these things, but as you can see, they're not. So, despite the fact that Trump is threatening to execute drug dealers and all of the promises he's made since the time on the campaign trail to get rid of this addiction, nothing has been done. It continues to get worse across the nation and not better. Please tell me what you think, ladies and gentlemen. It is really a shame, but they have too much pride to admit they don't know what to do. And that makes the whole thing even worse. Please leave your comment and subscribe. Don't forget to hit on the notification bell and join me on Black Junction TV, blackspot.com. Peace, family.